Dr. Miller-Meeks for her 5 minutes of questioning.
Thank you very much, Mr. Chairman, and I want to thank the witnesses of both panels for testifying before the subcommittee today. I probably have a unique perspective coming into this hearing. So first and foremost, I was a newly made lieutenant at Walter Reed, where having been an emergency room nurse, I was then a neurosurgical nurse working on a floor that had comatose patients, brain dead patients, and talking with family members, doing studies to ensure they were brain dead, and then talking to those family members about organ donation. Then I did that as an emergency room doctor, serving on trauma, doing a general surgery internship in a very busy hospital, Bexar County Hospital in San Antonio, and then finally through my residency in ophthalmology. So both as a nurse and as a physician have been in those very delicate conversations with family members, determining first and foremost that their family member is in fact brain dead and may not continue to have a viable life. And then as a physician and ophthalmologist, doing vision-saving corneal transplant surgery on children, on adults with chemical injury or heritable diseases. And so when I say that donation is only possible due to the public trust and the generosity of donor families, I know that firsthand. And following the September 24th, 2024 hearing and the subsequent story regarding Kentucky's case in October, the Iowa Donor Network experienced a 78% increase in registry removal requests, with 193 requests compared to the same time in the previous year, in which we received 75 requests. And the sharp increase in registry removal requests following recent events clearly demonstrates how fragile this trust can be and how vital it is that we protect and restore it. And I know, Dr. Lynch, that that is also what you would like to do, and I know that's what OPN and UNOS wants to do as well. So I have a little bit different history than other people, and I haven't removed from my driver's license, nor has my husband, that we're donors and that we want to donate and provide that life-saving or sight-saving organ, if we're healthy enough to do so, to someone else, child or adult. And this is not a system that has been in place for a long time. I mean, the system that I worked at as a nurse and a physician, we didn't have the 2023 Securing U.S. Organ Procurement and Transportation Network, the OPTN network. So it's newly established. And I think it's unfortunate that we are going through a process now where there will be, as we learn from one another, recommendations and processes that have to be changed. Dr. Lynch, can you detail how much of the funding has been allocated to date and where that funding has gone that has been provided to HRSA to improve the systems?
Sure. Thank you for your perspective. We share that in HRSA. This is something that we want the public to feel that it is, we are worthy of trust in the system. And for those family members of individuals who have gone through the process, we want them to be able to feel consolation and pride that their loved ones made that choice. So in terms of funding, before the Securing the U.S. OPTN Act, HRSA was limited by statute at $7 million. I believe in the last year it was $23 million that we spent since the Securing Act. We have undertaken several tasks. From an operations perspective, the most important is that we now have not just one operations contractor, the legacy one. We have a new contractor, AIR, which is providing support to the board, and that helps them to have independence from the rest of the system. We also conduct a lot of what we call discovery tasks or discovery contracts, which are really to get external expert opinion, and then from within that, pull from the community to understand all elements, logistics, allocation, policy making, communications, technology.
I have a bill, the Organ Donation Referral Improvement Act, which directs HHS to study and promote the widespread adoption of automated electronic referrals for organ donation. However, HRSA could initiate this transition on its own. Are you familiar with automated referral? And if so, have you worked with health systems and OPOs to further understand how it could be implemented on a wide scale.
I'm familiar with the concept of automated donor referrals. I'm unfamiliar with your piece of legislation. I'd be happy to look at it.
Thank you. I think further collaboration, working together, standards and processes in place will help restore the trust of the American people in organ donation, which is an extraordinarily valuable service that we